I was out yesterday.
That's great. You can sit with us if you want. Okay. Part of me would want to
I can forward you the one that they sent me today. It's got the council email address. I know that the people out there, they go through LCD, so they never talk about it. So what I was just looking at it,
Hello.
How are you?
I'm very good. How are you? I don't know your name. Oh, I think I've seen you before, but I just didn't remember. Nice to see you. Yes. And I've got your presentation ready to go.
Thank you very much.
There's a clicker right on that podium there for you to press, and I've checked it and it works. Okay, I can give them to the board. Absolutely. Yep. That's the way we roll these days. Thank you. You're very welcome. No, no, I've given it away already. If Rika doesn't come, then you're welcome.
Yes, it was. We called it inversion. Yeah, the next 3 days is going to be pretty strong.
There, I'll be right back at my.
Chief Brown. Hi, sorry, sir. Hello. Thank you. You too. You too. Hey, if you got a minute after we wrap up, maybe we can catch up with Anna. I was talking to her about that contract. Oh, okay. Good. I'll come down. Perfect. Yeah. I think she's maxed out until we get the budget done in February, but after that we should be good. Perfect. No, that sounds good. And Shirley came in too, so. Good. No, hey, that's exciting. Yeah, please. Excellent. Thanks for the help. No, that'd be great. Open a door. There she is. Yep.
Where did she go? Joelle. Oh, it's not working. Okay, you're welcome.
Thank you. Nice to be here.
Thank you for your help making it on such short notice.
Of course. You get one and I get, oh, this one's for Laura. I guess this one's for you, yeah.
Okay. Thanks.
Welcome.
Nice to see you.
Tom Young, how are you?
Hi, Tom. Nice to meet you. So that's the official, I'm on
Yes.
letter from the
I
commission.
presume, yes.
Yeah.
Well, we could.
Wait, I want to see that letter.
Paychecks, yeah, paychecks. Is this Dr. Danko coming in over here?
Uh-oh,
Oh, she's making the meeting?
that's her.
Yes.
Oh, good.
Great. Excellent.
Well, let's just wait.
That's Rika Danko.
That's great.
Good thing I put her sign up.
How's it going, Tom? Glad you showed up.
Can you tell Rika, not Rika, Joelle?
Ready.
That Rika might have the packet.
Good afternoon, everybody. Welcome to the start of a new year for the Washoe County District Board of Health. We got a lot of little things on the agenda. As you can see, it's a kind of a greet and meet today. Got a couple new members on the board this year, and we'll introduce them in a minute. Can we have a roll call, please?
Chair Novak,
Here.
Mike Brown.
Here.
Oscar Delgado. Here. Christopher Dare.
Here.
Dr. Danko.
Here.
Tom Young.
Here.
Marcia Burkbigler.
Here.
We have a quorum.
Thank you very much. And let's have a pledge of allegiance to get this started. Mr. Cutts, would you want to lead us, please?
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, everybody. Madam Secretary, do we have any public comments? Good, thank you very much. And we have the agenda that's been published and approved. Do we have any approval?
I make a motion to approve the agenda.
Second, okay, Mr. Dare and Mr. Brown are both first and second. All in favor?
Aye.
Good, thank you. Recognitions, and I want to take just a second here to recognize Kitty Jung for all the time she put in with the health department. She started her tenure here in January of '09, and she has lived through a whole lot of things with this health department. We've come a huge long way since '09, and I just want to recognize her and thank her for all her efforts. She's not here today, but Marcia's going to be taking her place, so welcome. Thank you. Welcome. And also the new member is Dr. Danko. She's going to be here. And would you tell everybody a little bit about your background?
Sure. Hello, everybody.
Okay.
Hello?
Nope, it's off. Now it's on.
There you
Hello?
Nope. Misbehaving. Oh, yeah, it needs to be plugged in. That would help immensely.
go. See, she's a doctor. She knows how to do that.
Got it.
Good girl.
Okay. Hello, everybody. Thank you so much. I'm so honored to be here with everyone. I am pretty much from Reno. My family came here when I was 5 years old from Budapest. And I grew up here in Reno, and I went to kindergarten through medical school here in Reno. And then I stayed at Renown Health and did my residency in internal medicine. I finished that in 2011 and joined a hospitalist practice in Sparks at Northern Nevada Medical Center. And then I migrated over to Northern Nevada Hopes, where I was the medical director for 4 years and helped to grow the primary care and the addiction program. And then I became subsequently addiction medicine board certified in 2018. And now I work at St. Mary's Hospital as a hospitalist.
Well, thank you. That's why the board was very thrilled to have her on as our physician, because she has such a wide background, and a lot of this affects the community and what she's in, addiction and stuff. And anybody that doesn't know what a hospitalist does, they're the ones that take all the stuff in the hospital while you're there. Your doctor may admit you, but when the rubber meets the road,
Yep.
Dr. Danko is the one that does it, so.
Thank you. Thank you so much.
Marcia, would you like to tell everybody a little bit about your background?
Sure. I have been on the commission for 6 years, and I'm up for reelection again in 2020. And that, of course, would be my last term, because I'd be termed out if I was lucky enough to win. And I grew up here in Reno. I actually grew up in Sparks, graduated from Sparks High School.
Okay, we're step to you guys already.
And I have a bachelor's in business management and was a lobbyist for many, many, many years, representing a big cross-section of businesses. But amongst my medical experience, I represented at one time, for a period of about 7 years, all of the physicians in the state of Nevada as their government affairs person. So I handle all of both the MDs and the DOs and many of their specialty societies, and handle their work here in the state as well as at the federal level. And my one claim to fame, when I took on a pro bono client called the Nevadans for Non-Smokers' Rights. You could smoke everywhere in Nevada at that time. Gives you some idea how old I am also. You could smoke in classrooms, inside of schools, elementary schools, on buses, in hospitals, and anywhere you wanted to smoke, you could just smoke. And so my one claim to fame is I changed the laws.
Well, thank you. Many of us appreciate that a whole lot. Okay, Mr. Health Officer.
Thank you, Chair Novak. We have some other recognitions that I'd like to run through. We have a retirement, Julie Pomey, who was a public health nurse 2 with CCHS, and she worked at the health district for over 27 years, so that is quite a stretch. If I'm not incorrect, I believe she was in Steve Kutz's nursing school class. Yes. Great service at the health district. She's not able to be here today, but we do have a beautiful clock that we will present to Julie. And it says Washoe County Health District recognizes Julie Pomey for 27 plus years of dedicated service, November 4th, 1991 to January 9th of 2019. And my understanding is that she is not entirely gone from the health district, because we have intermittent hourly nurses, and she's interested in coming back and participating in that capacity. Then I have a Years of Service Award for Yelena Yarganova, who is a biostatistician with our communicable disease EPI program, and I don't believe that Yelena is here today. So she's busy crunching numbers, probably. But congratulations to her for 5 years of service. We have a new hire that I'd like to introduce to the board, and it's Joelle Gutman. And Joelle, if you could just stand to be recognized. Ms. Gutman will be responsible for representing the health district during the upcoming state legislative session, and will also work to support health district policy interventions and governmental relations at the local and federal level. Joelle's is a new position. It's a government affairs liaison for the health district, and this is one of the elements that the board adopted in the strategic plan for the health district. I'm delighted to have her on board with the legislative session upon us, to have better capacity to deal with the myriad of public health issues that occur in a variety of areas down there. Ms. Gutman has state legislative lobbying experience working with Ferrari Public Affairs and the McMullen Strategic Group during the 2015 and 2017 legislative sessions. She served as the domestic violence ombudsman for the Office of the Attorney General, and most recently as the Rural Behavioral Health Coordinator for 7 frontier counties and the Rural Behavioral Health Policy Board. Ms. Gutman has a BA in Communications from the University of Arizona, Tucson, and a Master's of Social Work degree from UNR. So welcome, and I'm very glad to have you on board.
We all will be.
Have a number of Shining Star recipients that we wanted to recognize today. As people will recall, the Shining Star program is to recognize people that provide excellent customer service or work both for our external community customers as well as internally. And so I would like to recognize Linda Gabor. Linda, if you could stand, these are people that have 3 or more shining stars. So Linda Gabor, a public health nurse supervisor in CCHS, and Anna Gonzalez, also with CCHS with three stars. Nancy Kearns Cummings, our fiscal compliance officer in AHS with 3 stars. Laura Rogers with 3 stars with my office. Thank you, Laura. Susan Schroeder with Environmental Health Services. Congratulations to Susan. She has 4 shining stars. Corey Sobrio with public health nurse with our TB clinic. So thanks for coming over from our Kerman building. Good to see you, Corey. With 3 shining stars. Michael White, who does the I'm blanking on how to describe your job. It's the stock room supply stuff. What's your official title, Mike? Storekeeper. There we go. So with CCHS logistics, it's incredible. That does not describe what Mike does. He does everything. So he does a great job for us. And I don't see Jackie. Oh, there's Jackie. Jackie Chaidez in the back. Jackie has 20 shining stars now. Jackie works in the WIC program, and so has a great opportunity for providing great customer service there. So congratulations to all of you. Please stick around. We're going to do some photos in just a minute. But I wanted to also spend a moment to recognize Diana Karlasek. And so Diana, please stand. Diana has volunteered for at least the last 2 years. Has it been longer than that? Last 4 years, okay. I have a short memory these days. She's organized our Health District Adopt a Family campaign. And so she does an incredible job every holiday season with working across the Health District, communicating to staff, to get people engaged in supporting a number of families. And in 2018, we helped 5 families with a total of 24 people. We had 50 people from the health district that donated to the program. We had 57 people, or 57 items that were donated. We had $2,375 that were donated to the program. We provided these families with 155 presents that we delivered to them, 4 boxes of food that were donated, and Diana estimates the number of volunteer hours at about 50. And so on top of everything she does with her job, Diane takes this on for us, and so thank you very much for doing that.
Good. As kind of our tradition, we're going to take some photographs. And how do we do it? Do we do it in the moat here, or would I do it out?
In the moat? Okay. Do you need a ladder, Phil, to get okay.
Okay.
Chairman Nodak, if I could start with just a picture of the newly comprised board altogether.
No, yeah, that's you guys. You're still.
Just the board, sorry. Okay, on 3, 1, 2, 3, and one more, 1, 2, 3. Okay, all right. How do we want to do this? Want to do shining stars together? Sure.
Sure.
Okay, while we have all the shining star recipients come up, and we'll do a...
Right up here, Jack.
Okay, you need to be a little tighter because the move is tight. Okay. Three, one. Oops. That's a candy shot. 1, 2, 3. And one more. 1, 2, 3. Great. Thank you. Congratulations, guys.
Take one.
Like pictures. Like pictures.
I need to have my picture.
Right in the middle.
Right in the middle. That's it. There you go.
Good job.
Okay. 3, 1, 2, 3. And one more. To the yearbook. 1, 2.
And the new training course is next week.
One more.
One more.
Yep.
Thank you very much. Right there.
Okay. On 3. I promise. 1, 2, 3. 1, 2, 3. Awesome.
Thank you all.
Finger works a little faster than my counting. Okay. Christopher's scarf is falling all over the place.
You attended these one in Houston.
Oh my goodness, you kidding?
So I sent him a picture of the blue sky, the snow,
The blue sky
and the
was so-
56 degrees.
I was at Incline yesterday, it was beautiful.
Yeah, no kidding. Okay, after the good stuff, we have, the next thing is item number 6, which is the consent agenda. Does anybody have anything on the consent agenda they want to pull? Discuss? Okay, hearing none,
So-
do we have a motion?
Actually, I need to recuse myself from the minutes of it, since I wasn't here for that, so.
I think that'd probably be the best way of handling that, recuse both you and Dr. Danko from that
Perfect.
vote. But you're,
I was absent at that meeting also. So,
okay, come to a small problem.
It's not a small problem, Mr. Chair. You're approving the form of the minutes, not the exact content of the minutes, so the members that were not present at the meeting can vote.
Okay. Your vote for the minutes that are published then.
All right.
Okay, very good. Okay, do I hear a motion?
I'll make a motion to approve
Okay.
consent items as they
Good.
appear on the
Second.
agenda.
Second.
Okay, we have a motion made by Mr. Brown and Mr. Young seconded. All in favor?
Aye.
Opposed? Carried unanimously. That gets us down to number 7, a presentation on waste characterization study and updates on the community outreach activities by Waste Management.
With, I'm sorry, with waste management.
With Waste Management, okay, I'm sorry. He can't count and I can't read, so we're good.
Thank you so much. My name is Christy Chacarolo. I'm the Executive Director of Keep Truckee Meadows Beautiful, and I very much appreciate being here today. Actually, can we go back to the first slide? Thank you. So I am going to try and do all this in 20 minutes, so I just need you to strap in and bear with me. We're going to go quick. I've got actually 2 kind of different presentations to do. The first is I want to just bring you up to date about the Tire Fund funding that we are receiving from the Washoe County Health District for Keep Truckee Meadows Beautiful. For those of you who don't know, Keep Truckee Meadows Beautiful is a private nonprofit organization. We're actually celebrating our 30-year anniversary this year in 2019. We are the only nonprofit Keep America Beautiful affiliate in the state of Nevada. For that matter, we're the only Keep America Beautiful affiliate in the state of Nevada. There was one in Las Vegas for a short time, but they disbanded. We were founded by the Biggest Little City Committee back in the day in an effort to engage residents in helping to improve our communities through the parks and things like that. And we're still doing that. We've expanded a little bit. One of the ways in which we're unique as a Keep America Beautiful affiliate is that so many other affiliates across the nation are funded by tax funds. Being a private nonprofit makes us very different. Most Keep America Beautiful affiliates are part of the Public Works Department, so that's kind of interesting. I can tell you that we first started to receive funding from the Health District, and we thank you so much for that, starting back in fiscal year 2014-2015 to help offset the cost of dumpsters for our cleanups, and in our role as litter control partners. So with the tire fund, you may be wondering what that is, and that tire fund is provided to the Health District from the Nevada Division of Environmental Protection to provide waste reduction, recycling, and public outreach efforts. So this is our scope of work for the funding that we receive, and as I mentioned, we've grown over the years to include many community-wide cleanups, including the coordination of the Illegal Dumping Task Force. The Illegal Dumping Task Force was founded in 2006 as an effort to focus on prevention, and it includes many local and federal partners that focus on education and prevention, especially with educating the judicial branch. So in summary of the scope of work, KTMB is leading cleanup, education, and prevention efforts. I wanted to give you a little bit of a historical background on some of the illegal dumping that we've seen over the years because it's gotten a lot better. This is over off a military road back in 2013, and 5 years later, you can see development has really helped that site. It's a lot cleaner than it was. This site that you've already seen was actually our first illegal dump site the big one that we cleaned up back in 2006. We'll be talking about the litter survey later, and I can easily say that this would be a 4 on the litter survey, which is the worst. And we needed big, heavy equipment to get this clean. Happily, this area over behind Hidden Valley is much cleaner now. The horses are back. You can see that when sniffing my camera. There is a hot tub there, but depending on the angle, it looks a lot clean. It's definitely either angle, it looks a lot cleaner than it was. So that's some happy progress. This is a site up behind Damani Ranch High School. And this was taken back in 2011. It's one of the more heartbreaking pictures in my repertoire, because you can see, I mean, the horses are picking through the trash, trying to find food. Happily, this site, this year, or just recently, in the last couple of months, is much cleaner than it was. There's still a lot of horses, they're behind me in this photo, but it's much, much cleaner. So I'm happy to say that we have been making progress over the years. I've already mentioned the Great Community Cleanup. Prior to 2006, when we first did the Great Community Cleanup, we did a lot of individual cleanup projects, but 2006 was the first time that we created a really broad partnership with our Washoe County, City of Sparks, City of Reno, Reno Sparks Indian Colony, Bureau of Land Management, and United States Forest Service partners. And I have to tell you that that kind of a coalition has made a tremendous impact in our community. That first cleanup, we cleaned up 77 tons of trash. And there was still more out there because we didn't have enough funding for dumpsters. The second year we did this cleanup, we pulled out 144 tons of trash, which is as big as that sounds. It's pretty disgusting. Fortunately, that number is going down, and the number of volunteers that we're getting every year has gone up. One of the trends that we've experienced that I think you should be aware of is that we're finding a lot less tires being dumped out in open space areas, which is very good, but we're finding more sharps during our cleanups. When I first started at KTM in 2016, finding a hypodermic needle during a cleanup was unheard of, and now that's a regular thing. So we really appreciate the Health District for providing sharp containers for those efforts, so thank you. The litter survey, which I mentioned before, is something that we do as part of our affiliation with Keep America Beautiful, and it's our biggest evidence-based program that we have at KTMB, and it helps us rate how clean or how dirty our community is. We are getting cleaner, the numbers show that. It's a 4-point scale. As you can see, 1 is very clean, 4 is very dirty. And with the funding that we're receiving from you, we're actually currently working with our county, Sparks, and Reno partners to make this survey even more accurate and useful for the local jurisdictions. As far as Adopt a Spot, it is not exaggerating for me to say that the Health District funding you provide saved this program. This program was something that was started in 1994, and it was the only one of its kind in the country in that it was the only program in which we were charging people to go and adopt different areas of town, because we were trying to make it a self-funded program. So the idea was, you know, we provided a sign for folks, which was the municipality, the in-kind, would provide the sign for free as an in-kind partnership. And those businesses or community groups would adopt that section of roadway in return for the free marketing they would get from the sign and the team building opportunity they would get for the sign. But then we would charge them on the back end for that opportunity so that we could cover the costs of coordination and supplies and logistical support and removing the bags and things like that. Well, surprise, surprise, that didn't work very well. People don't want to pay money to clean up. And so this program was consistently running in the red. And so we were ready to get rid of it. We couldn't find grant support until the health district came in and helped provide the support. And so thank you for that. I can tell you that last year we had 1860 volunteer hours that were contributed, which with the value of the independent sector in Nevada, they say that our value of a volunteer hour is $21.85. So that in-kind value is over $40,000. So there's a real impact there. For us, our Adopt a Spot program has grown. Because we not only have Adopt a Park and Adopt a Spot roadside areas, but we also have Adopt an Open Space and Adopt a River. I can tell you that most of these cleanups that we cite up there, the focus is on neighborhood areas and roadways. But there's been a lot of success, I have to say. In this past year, we were able to pass out 2,000 promotional flyers promoting the program and how it's free now to people who will participate in our Christmas tree recycling program. And recently, we conducted an adult education presentation in Midtown, and the Midtown Rotary became an adopter. They're now cleaning up the Holcomb Medium. So we're making some real progress in getting new adopters. This slide is something we could actually use your help with. We could use your help in identifying groups that might be interested in adopting these areas. Out of 79 current spots available, 18 of these were adopted in the past year. As of 2019, January 2019, there are 34 more sites to be adopted, including these 13 open space areas. So any sites that you see on the list may be in consideration right now to add to the list. We're checking to see if it's public or private property, because of course we only work with public property. Now this Adopt a Spot map shows where all the sites are, and the green is those new sites that were adopted. The City of Sparks has chosen not to add new sites this past year, but we do work very closely with the City of Sparks through the Great Community Cleanup and the River Cleanup. But the City of Sparks also has their own Adopt a Park program. So you can see this program is pretty anemic, but this past year we've seen an increase in the number of adopters and new adopters, and right now we're busy focusing on our retention rates. So Christmas tree recycling, how many of you participate in Christmas tree recycling? Anyone? Thank you, guys. Okay, no, that's great. So Christmas tree recycling, this last year we had more than 10,000 trees collected, which was really exciting given the cost of buying a tree this year. We expected those numbers to drop. But we do always have 3 urban locations for this program, including Shadow Mountain Sports Complex, Bartley Ranch Regional Sports Complex, and the Reno Sports Complex, which was new this year. We moved that site from Rancho. And we've been partnering with the Truckee Meadows Fire Protection District because, of course, old dead Christmas trees in your house are a fire hazard. And so we have 3 rural locations also at TMFPD sites, including Lemon Valley, Washoe Valley, and the Cold Springs fire stations. So our community education program has really been on the rise. We've seen a tremendous increase this past year thanks to the support you provided to us. And I can tell you that these numbers are in no way estimated or made up. We take these counters with us wherever we go, and it's only after we've talked to someone to provide the education that we get to click it. So we know that we've educated or spoken directly with more than 16,000 people. And our recycling guide, which I, thank you, Laura, has passed out to all of you, is probably the thing I'm most excited about because your funding has allowed us to not only support this, but expand it so that we're able to promote it in the Reno News and Review. And just yesterday, I was at the Chamber Alliance event, and I had a gentleman come up to me and say, "Thank you so much for your recycling guide. I see it in the Reno News Review all the time." And I guess he's called our office and he got some additional help, which was great. And I said, well, you know what? Be sure to thank the Washoe County Health District. So if you get a call from a guy named Michael, that's why I asked him to call you, thank you. So the health district, you guys helped us expand this. We have a version in Spanish as well. And I can tell you that real estate companies have started including this in their welcome their welcome baskets, which I think is really helpful. The recycling guide is easily the most viewed page on our website, and I can tell you that KTMB does serve as an informal call center for how to dispose of many unwanted items. I think Michael's story helps prove that. And one of the things that, from your solid waste management plan that you updated in 2016, one of your goals there is to help recognize local businesses that are doing good things. And so I'm happy to say that Intuit, that has been doing an amazing job, they are being recognized this year at the Golden Pine Cone Awards for the work that they're doing. And I'm actually hoping to organize a tour for anyone who's interested to see some of the innovative ways Intuit has improved their recycling and saved money in doing so. It's really exciting. So this is kind of an overview of all of the projects that we've done with health district funds. I can tell you that easily, as far as in-kind support that we've been able to secure through this, it's over $300,000. When you combine that with the $357,000 estimated in volunteer hours that we've been able to leverage using the value of the independent sector, the value of the funding that you've given us, we've been able to leverage close to $700,000 of in-kind support. So we just want to thank you very much for that. We would not have been able to do many of these things without your support. So thank you. Are there any questions or anything at this time about any part of that? No? Okay. Because I get to roll into the next part of my presentation. You ready?
Ready.
Okay, so the waste characterization study was actually something that that was a part of your solid waste management plan update in 2016, and you guys just completed that. And so I just have to say, well done. You said you were gonna do it in 2016, you made it happen. And I'm here to talk with you a little bit about it because it's so closely aligned with what we're trying to do at Keep Truckee Meadows Beautiful. So one of the things that I've noticed, I've been with Keep Truckee Meadows Beautiful. They're celebrating their 30-year anniversary this year. I've been with the organization for 16 years now. And one of the things I've noticed in my 16 years is that nobody likes to talk about trash. Nobody wants to talk about trash. You know, we touch it every day, but once we're done with it, it's gone and we don't want to deal with it. But the thing is I feel like we really need to talk about this topic. We need to give it the attention it deserves because if you look at any media, this is becoming a real worldwide health issue. So it's interesting to me because there are communities like Charlotte, North Carolina. Their airport has managed to divert 70% of their waste. They have a vermilion compost system in their facility. And so they have, over 5 years, they're gonna have saved $1 million in disposal fees by composting all of their waste. And so there's really innovative, cool stuff that's being done around the community that I would love to see brought here. Because food waste is a huge problem. So this waste characterization study bears that out. And I'm thankful to say that I have Luke Franklin. He is the Senior Environmental Health Specialist with the Washoe County Health District. He is here to answer any specific questions you have about the study because he has that data. I don't necessarily have that. I've read the report, of course, but this study was done over 2 seasons so that they could get a better snapshot of the type of trash that we're throwing away as a community. And they were very scientific about it. They broke everything out into different spaces so they could accurately track and survey what was being thrown away. I mean, how lucky are we that we weren't one of these people sorting through the trash, trying to figure out what it is in that grid. And this is the type of stuff that they were going through. And just in this photo, this piece of the presentation was actually put together by the company that conducted the waste characterization study. I mean, you can see in this picture all of the green waste that could be diverted in that pile. So this is what they found, and I know it's not exactly easy to read, but for residential and commercial waste, you can see that food waste, yard waste, and dry recoverable fiber, including the clean wood, that's over 50% of the trash that we're sending to the landfill, and that's all stuff that could be used for usable compost. One of the things they found in their study is that there's a notable amount of recyclable material that could also be separated, so we're still not recycling to the level that we should. This is the self-haul analysis of all the stuff that was being sent to the landfill. And in the self-haul, the amount of yard waste spikes and more than doubles from the regular haul rate, which makes a lot of sense because, of course, the food waste drops. You know, it's self-hauling, they're not going to haul their food waste, they're going to be hauling yard waste. But that's all stuff that could be diverted and composted. This is the construction and demolition, kind of the overview of what they found. And easily more than half of this waste could also be diverted and composted. The inerts and the yard waste, that's all stuff that could be diverted. So as far as the study highlights, there are business opportunities galore for anyone who wants to divert and process and resell organic waste. It's a huge business opportunity for someone in this area. And also, we need to do a better job educating people about recycling. I mean, there's still a lot of wishful recycling going on, right? You hear Waste Management talking about that, how China's closed its doors to American recycling markets because we have so many people who want to do the right thing, but in doing so and throwing the garden hose that they want to recycle into the recycling bin, that whole load essentially becomes trash. And then, of course, with the self-haul, the amount of material that can be composted and diverted also increases. So there's a lot of opportunity here. Easily more than half of the C&D waste could be diverted. So this company had some great recommendations. And on top of their recommendations, I really want to emphasize that we need more education. I mean, it's education, education, education. You know, in so many ways, we're still kind of behind in this community. We need to encourage better and smarter recycling. There needs to be no more wishful recycling. There's such a high contamination rate right now. You know, we just need to really work on that. We need to, in my mind, we need to create a cultural shift and an awareness. I mean, think about our American culture. Our houses are bigger now than they used to be, and we still can't park our cars in our garages, because they're so full. And the self-storage, this is very fun. The Self-Storage Association in the United States says that there's so many storage units that it's physically possible that every American could stand at the same time under the canopy of the self-storage building. We have too much stuff. Also, our packaging industry is out of control. Have you ever taken a moment to ponder why our toothpaste tube needs to come in a box? Seems a little repetitive, right? So there's a lot of behavior change and awareness that still needs to happen. We also need to encourage businesses to divert their dry fiber and to report it. One of the things that, I know this is not going to be a favorable recommendation at all, but maybe we need to have a discussion about making reporting mandatory so it can encourage more people to divert their dry fiber and their waste, or encourage them, you know, to report on that. Currently, the health district really doesn't have any teeth in getting businesses to report. Maybe we need to allow for more variances or setback areas so we can change the code so there's less of a barrier for businesses and individuals to compost. And one thing that I'm hoping that you do is that you take this information back to your colleagues and your jurisdictions and talk about how you might be able to support and improve composting in our areas. So that's pretty much it on that. Are there any questions?
Go ahead.
You know, I've really appreciated what Keep Trucking Meadows Beautiful has done over the years, and have participated in lots of projects with them and offered lots of incentives to get more volunteers over the years too. But I really think that some of the issues that maybe the health department and Keep Trucking Meadows Beautiful can actually assist is, for instance, you mentioned composting a lot of times too, and that's a wonderful idea, but this community has very few major composting facilities. I mean, Donovan's the only one I think of that's actually even attempting to do this, and possibly even some other marketing efforts that might help encourage people to use these services and use some more compost might be in order. I mean, my business was actually sued by Waste Management at one time for our composting in the restaurants, and I took great offense to that, and it, you know, cost a bit of dollars to make that go away and things there too, but we need to really encouraging it, making it more convenient to do this composting so it works. And not being a big agricultural area here, I think that we need to encourage every homeowner who buys a bag of dirt to make sure it comes from a local compost facility if they don't do it themselves and things there too. But I think that Keep Truckee Meadows Beautiful is one of the organizations that has such a high success rate, and they can talk about their successes. And this is one that I think we could really throw our community over the top, because we have so much waste that's very, very difficult to compost.
Yeah, agreed, thank you.
Yes, I also want to thank you for the work you do and just at large, even at the river and all the different things. And when it comes to recycling, it's funny you bring that up. One of the things I'd encourage you to look at and talk to the entities about is the contracts that we have with waste management. Because what's happening right now is, though there's a culture, I think, that we've informed. Like, truthfully, I never used to recycle. I just never did, and it wasn't a thing. But now, like, I'm constantly looking for ways to recycle. It's just kind of one of the things that, even if you can train me, you can train anybody. So I know for a fact that a lot of people are thinking like this, but we actually aren't set up for a culture to respond to it, because I know for a fact there's other groups who want to do this recycling, and they're not allowed to go around and pick it up. So we have laws or contracts in place that our cities and our counties set up. We didn't think about it at that time, I guess. But now in this next round, I think we really have to think differently, or you're wasting your time. I'm not trying to be mean, but we can't push everyone against a wall that they go get sued for doing it. And so if we don't change something, though I think it's really wise and we better be paying attention, it's kind of, so I don't know. I don't know how we can be involved with that, but thank you for trying. But that would be the place, I think, your first step of changing that.
Thank you.
Yeah. Ms. Brown?
Is this thing working? Okay. Thank you very much for your presentation. You know, I look at when we talk about recyclables, and when you talked about the wood products that are actually going to our landfills and such that could be utilized, you know, biomass is such a big issue, but being able to store that biomass and biomass products. I know other counties and other states actually have where they'll let you deliver it free when it's clean, because they can ship it, they can use it for soil stabilization and such. I don't see that happening here. It used to happen out at Lockwood, but I can be real honest with you, to take that to our transfer stations is cheaper than to take it out to Lockwood. And so, you know, I think we need to work together and try to make this more efficient, but also make it easier for those customers to utilize so we can get it out there and try to use it too. So I think great ideas, but we as a board should try to find out ways of making that work as well.
Love that.
Anybody else? Yes, sir.
Thank you, Chairman. Full disclosure, I'm a big supporter of Keep Truckee Meadows Beautiful. So I sponsor you guys, support you guys in any which way I can. You guys do so much for our neighborhoods and our. One of the great things about the work that you guys do, it's not just cleaning up neighborhoods, it's bringing communities together. What better way to meet your neighbor than to actually walk through the neighborhood and help clean it up and take pride in that. So thank you so much for all the work that you guys do. I think this is great in terms of recommendations, and to Councilman Dare's comments. That's exactly the situations we're in right now, is figuring out how do we find opportunities to partner with some of those contracted entities to figure out where does it make sense for us to implement some of these options for recycling. We know it's it comes down to economics, it comes down to privatization, it comes down to all those factors that become so overly complicated sometimes when you're just trying to do the right thing. But it starts exactly with what you're doing today, and that's presenting to us the missed opportunities that we're not considering or have considered, and why aren't we making that next step moving forward. So I commend you on coming and presenting and constantly pushing, and it's something that I think for us it's going to be always looking to ask that question, what are we doing about this, or what are we doing about that? And that's exactly what I'm taking away today as an advocate of saying we should be doing better. So thank you so much for what you do in the community, and let's keep the conversation going. Thank you, Christy.
Thank you.
Anybody else? I do have one question.
Yeah.
Your number 2 up there, Washoe County Waste, going to Fulcrum Bioenergy. What can be taken out there? I know it's a new facility. What can we take?
Well, and they're still building it. So that's the thing. I went to their website today because I was hoping you would ask me, and they aren't planning on
That's
even
what you
being.
paid me for, right?
Yes, you're so good. They're not even planning on being operational till 2020. And so the interesting thing, though, is Fulcrum is not being built within Washoe County. They're being built in Story County. So I think, it's asking these questions of what can be sent there and how can we work with them, and maybe asking staff to put together a report and finding recommendations for what can be done and implementing those recommendations.
Good. Thank you very much. And I really thank you. This was a good educational thing for the board as a whole. And we look forward to seeing you again one of these days.
Great,
Thank
thank
you very much.
Thank you so much.
Okay, moving on to number 8. Mr. Dowell and Associate.
Good afternoon, Mr. Chairman, members of the board, and new members of the board. My name is Dean Dow. I'm President and CEO of REMSA and CareFlight. You all have received copies of our November and December compliance report for your review. So I'm available to answer any questions if you have any.
Okay, these are action items. They were published in your packet. Does anybody have any questions for Mr. Dowell? Okay. Hearing none, do we have a motion to accept the reports?
So moved.
Ms. Brown? And Marcia, seconds. All in favor?
Aye.
Opposed? Nay. Carried unanimously.
Thank you.
And we need a longer report. Thank you.
Good afternoon. My name is Alexia Jobson, Public Affairs Manager for REMSA for the record, and I am happy to present today's Public Relations report. You have the report for November and December, so today I'll just give you an update about some of our current community and public relations activities. Recently, we've announced the achievements and addition of several new employees across the organization which have garnered media coverage. This includes the appointment of our Clinical Communications Manager as a regional instructor for the International Academy of Emergency Dispatchers, as well as the hiring of Barry Duplantis as CFO to replace retired CFO Pam Bowe, and the addition of Deborah Cotrati as our new clinical education nurse. In early January, our education department celebrated the graduation of 16 new paramedics. Education manager Cindy Green said of the new graduates, "We are very proud of our newest class of paramedics, and we are confident they are prepared to provide compassionate, clinically excellent paramedic level care throughout our region." Next, the Journal of Emergency Medical Services recently featured an article I submitted through my work with the Academy of International Mobile Healthcare Integration with information about how enhancing a public and community relations program can build awareness of an affinity for an EMS agency. And finally, KUNR's On Gray attended REMSA's bleeding control class last week and conducted in-depth interviews with our education coordinator, as well as class participants about the importance of developing bleeding control skills. I anticipate that story will run next week. I'm available to answer any questions if you have.
Yes, sir.
I do have a question, and this might go back to Mr. Dow as well. How are we doing on, I saw 16 people graduated. I know for a fact we're stealing as many of you guys as possible to come over to the fire department. I know Reno's been jumping on that a little bit here and there. And we all need paramedics. How are we doing on hiring? How are we doing on that? And if it's getting tight, how are we trying to get out there to get the right people in place? No one wants to answer that one.
I think to broadly answer your question, I think from a national perspective, for the last several years, there's been a decline in the amount of EMTs, advanced EMTs, and paramedics in the career pipeline, if you will. Generally, what we're seeing is a lot of those folks today are going off into other fields, IT, et cetera, maybe other facets of healthcare, so nursing, those kind of things. One of the things we have recognized with that and done here locally, just in this since December, is all 8 fire departments in this area, along with REMSA, jointly came together and created a new paramedic program. So we continue to have ours on our campus, but we created one specifically for the fire service that matches their shift work schedule. So it's a lot easier for their already employed personnel that have a desire to become a paramedic to go to that program. And it, leaves them some quality of lifetime plus obviously work time. So I think I'll speak for all of us. I think it's going to be a battle over the next few years, but it's one that I think we're facing, and hopefully between all three classes, if you will, we'll still be able to put good quality clinicians out on the street.
I have a suggestion that we've talked about, but I want to bring it up here. One of the things I think we need to be wise in, because this is our area, and we do this for our city with police and fire, is we try to find ways to make it, this is the coolest thing you can do, and we advertise and we find real ways to do that. I think as a health board teaming up with these guys, I think we need to make sure we are doing what we can to keep this job at a place that this is hero status. This is something that people want to be a part of. And I know we do different pushes of, we have a campaign for this or campaign for that. I really think it's important that we do something and think about doing a campaign potentially that would talk about that these are first responders. This is a hero status job, and the importance of it, and the pay that's there, and the benefits, and just us coming alongside. Because if we're not careful, we're going to find that we keep getting less and less and less people, and that is our problem. And so that's where for us for that campaign could be real important. So just want to bring that up.
Excellent suggestion.
Good. Anybody else? Thank you, Mr. Dow. Thank you very much. Okay, moving right along, the presentation, discussion, and possible approval of the Emergency Medical Services Authority, REMSA, and their compliance report. Brittany, take it away. Thank you.
Good afternoon. Brittany Dayton, EMS Coordinator for the record. I would like to start by welcoming our two new board members and also saying congratulations to our new chair and vice chair. On an annual basis, the District Board of Health has provided a presentation on REMSA's franchise compliance report for the previous fiscal year. Before you is a staff report, compliance checklist, and compliance report. These documents are an assessment of REMSA's adherence to the various requirements of the amended and restated franchise for ambulance service. For fiscal year 2017-2018, staff found REMSA compliant with all auditable franchise articles, and therefore recommends that the board approve the compliance report for 2017-2018. I have brought all my compliance documentation with me over there in my binders, so I'd be happy to answer any questions that you have about the report or the checklist.
Anybody have any questions for Ms. Brittany? Hearing none, do we have a motion to accept the report?
Move to approve.
Okay. Second. Marcia Bearsticker, second. All in favor?
Aye.
Opposed? Carries unanimously. Thank you very much.
Thank you.
There is a huge amount of work here for you and the whole staff, so thank you very much for all the hard work. So.
Thank you.
Good documentation.
Okay. And now, Joelle, come forward. You gonna help with this too?
Yes, Chair Novick, why don't I take a crack at this, and I'll use Ms. Gutman as my safety net. So
Big job.
so this
Can't turn your mic on.
I'm sorry.
That's really small print, my friend.
So there's a lot of bills. So we tried to save some resources so we wouldn't have to do as much trash disposal and recycling.
Oh,
And
you're a wise man.
so this staff report is really the kickoff to the legislative season that we do every 2 years, have been doing with the board, in which we provide a couple of fairly short documents, which are the Washoe County Health District legislative principles, and then also our 2019 legislative priorities. And then we also have a spreadsheet that shows you the bills that we've evaluated to date, the ones that we are intending to be engaged in testifying on, as well as bills that we support, but at this point don't have plans to testify on. So the green in that being the ones that we intend to actively engage in, and the yellow that we support. There are a lot of bills that we're neutral on, that we're tracking, and we can go through and answer any specific questions you have on these. But I wanted to spend a minute talking about the legislative principles and our priorities. As you know, we have a lot of action in a short period of time with a 120-day legislative session. And so the legislative principles are intended to be basically the elements that we will consider in taking action on bills during the month-long period between the Board of Health meetings. So these are kind of our guiding principles in our decision-making for how we would respond to new bills, to changes, amendments that are made to bills, et cetera, in determining what the health district's position should be. The priorities are kind of the broad brush priorities that we've identified that we'd like for your approval of also for the coming legislative session. We've talked during our strategic planning meeting, and I've appraised you in monthly reports of the work that we've been doing to try to promote for the state to increase their funding of public health. We're currently 50th in the nation, and we'd like to have the state provide basically a caseload funding for public health that's set at $5 per capita of additional funding each year. That would bring us all the way up to 49th in public health funding for the state. I think everybody is aware of the huge investment that we make in healthcare within the state, and we have a very minuscule investment in public health, and I think as long as that continues, we'll have to spend more and more and more on healthcare, and rather than trying to control those costs by having a good public health investment. The e-cigarette priority, everybody has heard of the huge explosion of e-cigarette use in youth. And so we're looking for more regulation of e-cigarettes by licensing e-cigarette retailers as cigarette retailers. We want to expand on some of the marvelous work that Commissioner Burkbigler has done historically by including vaping in the Clean Indoor Air Act to prohibit that where people can't smoke. We'd like to see e-cigarettes appropriately included in the statute for other tobacco products so that they're taxed as other tobacco products by the state. And that provides one option for a way of increasing that public health funding by having that revenue stream from e-cigarettes. The last element here on the e-cigarettes is one where if there's an opportunity, we would support moving the legal age for purchase of tobacco products to 21. There are a number of states and communities that have done this. I don't know if it's achievable, but it's something that we would aspire to do if there was an opportunity to move that direction. On behavioral health, our priority is supporting the bill that came out of our Regional Behavioral Health Policy Board that is for establishing a crisis stabilization center and services in Washoe County. The bill also provides, it's a population-based bill for these centers in counties with a population of over 100,000, so Clark and Washoe County. This basically would provide immediate care for people that are experiencing a mental health crisis or experiencing a substance abuse behavioral problem, and would provide that crisis care to stabilize the patient, de-escalate them, and provide them with continuing care at the lower appropriate level of care. So this would be much better than
having law enforcement, for instance, delivering somebody to the emergency room and be stranded there for hours waiting for a slot in the ER, and then the person really is not getting any care in that environment for their behavioral health needs. Or an alternative to that is they're booked and they're sent to the jail. So we think this is a good approach. It's been very successful in some other communities in providing for much better care for people in crisis. And then we have a couple of, and I guess I should mention the Behavioral Health Crisis Stabilization Center is in alignment with the behavioral health component of our Community Health Improvement Plan that the board has adopted. And then on housing and homelessness, these also align with those elements in our Community Health Improvement Plan. One is to support the pilot program that's being proposed as a BDR out of the Task Force for Affordable Housing that Senator Ratty was chairing, that would provide $10 million of transferable tax credits for affordable housing. It's a program similar to the film tax credit program. We heard Governor Sisolak mention it in his State of the State address is something that they've incorporated in the budget. And then under the homelessness, this also is a BDR that is going to be coming out of that Affordable Housing Task Force, and that is to provide Medicaid reimbursement for supportive services for the severely mentally ill. Medicaid is not able to provide direct reimbursement for housing people that are severely mentally ill and homeless, but these wraparound support services would be services that could help people maintain tenancy, be able to stay housed if there's housing that can be provided for them. So this is the short list of kind of key priorities that I'd like the Board of Health's approval for. But then recognizing through all of the fine print on the spreadsheet that Ms. Rogers has put together, that there are a number of bills that are, and this is just the beginning of what's come out so far, that have either a bearing on public health in some way, or they have a bearing on the health district in some way. We've got some bills with changes to the open meeting laws. We've got bills that address collective bargaining. We've got bills that address the PERS retirement system, et cetera, all of which would have some effects on the health district depending on what happens with those. So that's my summary on the report. I'm looking, I guess, for if there are any questions on particular bills, be happy to respond to those. But I'd really like to have the board's approval on our approach with the principles and the priorities.
Any questions? Yes, ma'am.
Thank you. I'm just curious on which I really support this idea of keeping people who have drug problems and mental problems as a result of using controlled substances out of the jail. Mm-hmm. I mean, as one of my fellow commissioners says, that the largest mental hospital in the state of Nevada is the jail, and so that would be very nice if we weren't doing that. So is there a thought on, if we're not taking them to the emergency room and we're not taking them to the jail, what are we going to do with them? Is there a thought in that process for that legislation of a place? I know you're working closely with Ms. Howell from HSA on the NAMS campus, but have we come to some conclusions on something we could do there yet?
Well, I don't think we have a solution for a lot of additional inpatient beds, but the hope with the approach with the Crisis Stabilization Center is that we can help to get people into either maybe a short stay of inpatient care in the bed, or into programs that are active outpatient programs that can help to accommodate their needs at lower cost than providing a bed for everybody. There's a terminology of of the living room treatment, where instead of somebody being in an institution, they're provided more of a caring environment.
Which is a great
for
idea.
getting that care. And there's a program in Maricopa County called Crisis Now that we've been looking at with this, and they have achieved huge savings. I think what I saw was they're estimating at like 97 FTEs of law enforcement just by them being able to drop somebody off in one of these centers in a period of less than 15 minutes versus spending hours in the ER. And I actually have a meeting scheduled with Sheriff Balaam and some of his staff tomorrow to talk about this and some other issues. But I think that the health district and the sheriff will probably be in alignment on a number of legislative issues in the coming session.
Great, thank you.
Good. Yes, sir.
And I don't want to veer too off on the agenda item, but in line with those questions, Commissioner, I know currently the CHAB board, I think, is going to be presented with the well care, and I think those may be opportunities, and I don't necessarily know how that plays out, but I know that's going to be somewhat of a crisis stabilization, so to say, model. But as these other ones that have been tested and best practices to other countries, are maybe opportunities for us to also get our heads around about what's been proven, what are our needs. And I think to your model, the Crisis Now is one that I've seen that's been tested and is now has a great model, and that may be an opportunity for us at the CHAB board to continue those conversations to transition from here to that board as well.
Great, yeah, CCAP's gonna be great.
Yes, sir.
So I just kind of piggyback on this conversation. It's the thing that I think is kind of neat in all the boards that we serve on, that it touch this at all. We're all saying the same things, whether it's our private entity, each of our cities, our county, but also on boards we all serve on together. So there's a lot of support for all of this, but I don't know how much support yet there is in Carson City. And I say that to say I think this, as much as there's a lot of different things to look at, I would say this is probably one of the most important things that they can talk about when it comes to the care. And I know we're talking about homelessness and some of this stuff, but the problem is that affects everything. It affects so much funding, so much budgeting. And so I just would challenge us to push to really keep this at that center, important place. The other thing, we had a conversation the other day that you were talking a little bit about, and the reason that finance is coming in of a $5 a person or whatever was kind of had a even more value, was because of some taxes we might potentially that we might lose. Remember that I just think it's an important conversation we all have. So we get certain money from a certain tax now that might disappear. Can you talk about that for a minute? Because I think that gives us a little bit of urgency for that first thing you talked about.
So I think what we were talking about was the revenue that we get from the smog check program. So it's not technically a tax, I guess.
Okay, sorry. Wrong
but
word.
It's still money that comes in from there. Currently, we have the smog check program in Washoe County and Clark County. And for people, the smog test facilities, they are charged a certificate fee for each smog check that they do. And the health district, we receive $1 from each smog check under the Air Pollution Control Fund to be able to support our air quality management program. The discussion that I had with Councilman Dare is that we had Ms. Albee was participating on a subcommittee of the what we call the I&M program, inspection and maintenance, looking at the smog check program for the state, that looked at alternative approaches to conducting the smog check program. It was kind of ironic because we had for multiple sessions bills that would have weakened the smog check program that were being presented. And then the session before last, we were able to ward off some things that could have been bad with those changes by saying, let's establish this subcommittee to look at how those the program might be improved. So a report was developed on that would change some of the frequencies, et cetera. of testing that could still maintain good air quality for us. But then nothing surfaced during the last session at all on smog checks. Discussion I had with Councilman Dare was what we'd like to see if there's a legislative change to the smog check program is to find an alternative funding scenario for providing funding to support air quality so that we're not tied to the smog check industry and those smog checks. We've got onboard diagnostic systems on our vehicles now, and so all the newer vehicles, when you're getting your smog check, they're just plugging into your onboard diagnostic and seeing that everything is working okay. What we call OBD3 is a future onboard diagnostic system where everything is in the Internet of Things, and there's no reason to go to a smog check station to demonstrate that your vehicle is operating properly. That information could just be harvested basically from your vehicle. And we don't want to be in a situation where we have sort of a perverse relationship with the smog check industry where we're trying to push to keep a physical smog check going if we don't need it, because that's the only way we can get our funding for air quality. We'd like to have something tied to perhaps the annual renewal that's a separate air pollution fee that's collected at the same time, or something like that that would support us. So appreciate you bringing that up.
Anything else? Yes, sir.
I just have a question. So I guess I was unaware of this. So e-cigarettes usage is not taxed at all now?
They're only taxed just as any other
Like a sales
product,
tax versus
just
like
through-
any sort of like no excise tax on it?
That's correct.
Okay.
Very good. Do we need to accept the report?
Excuse me, Mr. Chair, I believe that the district health officer is asking you to approve the principles
The
and
concept.
priorities.
Okay, good. Do I hear a motion to keep us all working on that direction?
So moved.
Okay, second. Okay, Mr. Brown, all in favor?
Aye.
Opposed? Another one carries unanimously. Very nice report, Joelle. We appreciate your work.
Don't
And
talk
I
so
know we'll
much.
hear a lot from you in the next couple months, so thanks a lot. Okay, moving along to staff reports. Ms. Albee.
Good afternoon, members of the board. For the record, Charlene Albee, I'm the Division Director for Air Quality Management. We have just recently, last week, received notification that we are going to be having a vacancy on our Air Pollution Control Hearing Board. Joe Serpa has been a representative on that as the required contractor. Statutes, regulations require that our hearing board be made up of certain individuals. Lawyer, licensed engineer, and a contractor are the three that we have to have. The others are at large appointments. So we have posted on our website the vacancy announcement, and we notified the Builders Association of Northern Nevada at a meeting last week, and have also notified AGC. So we will be actively recruiting to see if we can get a volunteer to step up to fill that position. We do have it open through the 1st of February, and we're hoping that next month we'll be able to bring in a list of nominees for your appointment. One other thing I wanted to let you know is that I will be going to Washington, D.C. next week, attending the National Association of Clean Air Agencies Executive Board meeting. That is going to be on Tuesday and Wednesday. And on Thursday, I'm in contact with Senator Cortez Masto's office that I'm hoping to sit down with the staff there to give them some updates on the struggles we're seeing in the air pollution control field with the frontal attack on the Clean Air Act. And we'll see what we can do to try to get some support. They've been very supportive on the local level, so we're going to see if we can't get some Washington support. There's Senate Bill 1857, which is already passed, Environment and Public Works, that's going to it's in the list as soon as they open back up and start doing things to delay wood stove standards for 3 years, which is going to have a real significant impact on our ability to attain the ambient air quality standards in this area. So we've got some national work and attention that's coming, so wanted to make you aware so you didn't happen to hear something and not be fully informed. So I'm available if there's any other questions.
Questions?
I just have one quick. One of the things I wanted to tell you, I got to do a tour of a HUD house, new affordable housing over in Reno. I don't know if you got to see it yet, Oscar, but it's Dane Hilliard's group who did it. But they did go through and everything, they put all the bells and whistles, all the stuff we've been talking about. And they have a groundbreaking coming, not a groundbreaking, like a ribbon cutting thing coming up in about a month or so. I think it'd be a perfect opportunity if you guys wanted to find a place for us as a health board to say, hey, let us give you some certificate that says you're the man, thanks for stepping up and know what you're supposed to be doing. But I went through, it's a beautiful place, but even more than that, it's all efficient, high efficiency, and I think the stuff you would appreciate. So I think it'd be really good for us to continue to get out there and let people know who are doing the right thing, that we are seeing it, and they get something they can put up on their wall that says we think you're cool, and keep doing it.
All right, yeah, we have that in the staff report here, the Northern Nevada Medical Center stepping up for their new hospital facility. So it's starting to gain traction, and I think that if we do have a recognition for those things, that would be good.
I think one of the things, just to throw it at you, Chair, is the idea that maybe if we're giving out one of those, that we actually show up to go and say, we come to, some of us from the board go and show up and say, hey, we want to present this to you from our board. So it gives it some weight. It's not just a piece of paper. But I think it'd be wise for us to actually go, and whether it's them and anybody that's willing to put a little more effort to do the things that we need in our community for air quality and all that. So that'd be an idea.
Good, thank you. Anybody else? Okay, I got one question on this wood stove and putting off this. I know that could have a drastic effect on us and some other communities that live in a bowl like we do. Can we, or how do we go about enhancing our regulations, maybe over not the national standard, but can we go ahead and say, okay, Washoe County, we're in a very unique situation. Here's the rules we're staying with. Is that possible?
So it's very interesting that we actually did adopt the new source performance standards. And part of the language was we would adopt the emission standards with a statement in there, unless the federal government, unless EPA adopts a stricter standard, those would apply. So at this point in time, if they roll it back, we actually are in a position where we can hold them to the higher standard. What it's going to do is essentially set it up the same situation that they had in the state of California, where you could only sell California certified cars and not other cars. So the manufacturers ended up with dual standards. That's in the process of starting to happen across the country. So yes, we are going to be able to protect our standard, but it's going to put us in a position where we could potentially be legally challenged. And if we could avoid that, that would be in everybody's best interest. So there's a big push right now. We, as an air quality division, actually the health officer sent a letter to the senatorial staff, and the association I'm the vice president of, NACA, we sent a letter to all senators in the United States, bringing this to their attention. So we've got some real good supporters, but we have an industry that has highlighted that they will have a $0.01 billion financial benefit with a 3-year extension, and EPA did the analysis, and it's a $0.27 billion health impact. So they looked at just the revenue for 3 years. Unfortunately, the life of a wood stove is in excess of 20 years, so we would have the excess emissions for that entire time. So the numbers don't pin out, so it's just a case of having to get through the political atmosphere we're in the middle of.
And thank you for working on a national level too.
You're most
It's always
welcome.
fun, challenging, and interesting to say the least, so.
So
Very
hopefully
good.
I'll have a good report for you next month.
We do too. Thank you. Okay, Mr. Cutts.
Good afternoon, Mr. Chair, members of the Board of Health. Steve Cutts, Division Director for Community and Clinical Health Services for the record. Just wanted to add on to my report a little bit regarding the WIC information and how staff have been trained to provide services to federal employees. I wanted to let you know that WIC will be attending 2 events for federal workers affected by the government shutdown. We'll be at the Reno Town Mall and the Reno Airport over the next couple weeks. So we're excited about the opportunity to provide assistance to people who are affected by the federal shutdown. And with that, I would be happy to answer any questions you may have regarding my report.
Any questions? Good. Thank you very much.
Thank you.
Moving right along. Mr. Weston. Questions? Okay. Nice report. Very good. Okay. Dr. Todd. Always interesting and has something unusual for us. Most of which we can't spell.
Good afternoon, Mr. Chairman and members of the board. For the record, I'm Randall Todd, Division Director for Epidemiology and Public Health Preparedness. I just had one thing that I wanted to bring your attention to in my written board report, and that's in the section under Emergency Medical Services. Specifically, we had under Pediatric Disaster Response Training, so our EMS coordinator had a group from Texas A&M Engineering Extension Service come out and do this training in the area of pediatric response. And it did get some news coverage, so I will ask Laura to roll that for you.
Disasters can strike anytime, anywhere. We usually think of getting out of harm's way, finding shelter, or emergency medical care. While all of that is natural, ever wonder how a young child reacts to these situations?
Cool 8 News Now's Terry Russell shows us there's an entire seminar devoted to it.
Last May, we showed you pictures from New Jersey. A school bus carrying 5th graders and their parents crashed into a dump truck.
I need about 20 ambulances. I have a full school bus and I have victims on the ground.
One student and a teacher died in this crash.
Be advised, we have 2 young females who are in progress. I got 1 child shallow breathing with a head injury.
Children were reunited with their families at regional hospitals. Such a response does not happen automatically. It starts here.
Not really planned on all the downstream effects.
In classes, which address children and their response to disaster and how to prepare for their reaction.
And so we will talk extensively about these downsides.
Greg Lord is one of the instructors at this FEMA-sanctioned event happening over the next 2 days at the Regional Training Center.
And how do you do all those things in a manner that keep the children safe and ensure that there's a process to help them with their mental health as well as their physical health?
Representatives from local hospitals, EMS nurses, and even Washoe County Health District are here to learn how they can more effectively respond to the child or children involved in a disaster event. With the knowledge gained here, they can check their departments for deficiencies and correct them. The next step could be a public awareness campaign for families themselves to prepare for events, as emergency crews won't always be immediately available.
You can rely on our first responders, our governmental entities and such, only to a point. In a mass incident, earthquakes, floods, fires, we need to ensure we're doing everything we can personally.
The bottom line to the class is being prepared to treat and manage the pediatric patient in a disaster setting and understanding their needs. After all, children are not just small adults. In Reno, Terry Russell, KOLA 8 News Now.
Disasters can strike anytime, anywhere. We usually think of getting out of harm's way, finding shelter, or emergency medical care.
Yeah, sounds like it's going to repeat. So thank you. Phil Uliberry, our Public Information Officer, informed me just before the meeting that that segment that you just saw had 60,700 viewers and a monetary value of $15,950. So we would not have it in our budget to actually go out and purchase that kind of coverage, so it's great that when events like this become newsworthy, that we get that type of coverage. Would be happy to entertain any questions that anyone may have about that or any other thing that you see in my written report.
I just have one question. I've actually have a lot of people I'm hearing have the flu. Do you want to just tell us, dive into that? It seems like it almost, to me, it seems like it came so quickly, but.
Well, the good news is that this has been a somewhat milder flu season, quite a bit milder than what we experienced last flu season. We've had so far, I believe, only one flu-related death reported, so that's a good thing. For the week that ended January 5, as you can see in my written report, we had our 12 participating Sentinel healthcare providers reported a total of 186 patients with influenza-like illness. So that doesn't mean they had diagnosed flu. That means they had an illness that was sort of compatible with the flu, but may or may not have been. So the percentage of persons seen with ILI or influenza-like illness by those 12 providers was 2.8%. So that was 186 out of 6,720 patient visits. So that is above the regional baseline of 2.3%. And so yes, we have, we are right at that time of year where we would expect to see a fair amount of flu. But again, you have to compare it to last year to appreciate that we're having a pretty decent season this year.
Is part of that because of our efforts in flu shots, you think, or is it just an easier year, or can we take a little credit for stepping on that?
I wish I could say that it was due to our efforts, but I don't think I can realistically say that. Here in Nevada, we have one of the lowest rates of flu shots of anywhere in the nation. So that's not a statistic that I'm particularly proud of, but it's true nonetheless. I think the main reason that we're having a better year is that the dominant strain of influenza this year is the H1N1 virus, which the flu shots that are out there seem to work a little bit better on as compared to what we've had the last couple of years, which was the H3N2 virus, and that one it is not as effective against. So anyway, but we continue to plug away at trying to promote flu shots. And until the flu season is actually over, it's not too late to get a flu shot, but people should be aware it takes a week or two before that flu shot becomes fully effective, even after you get it.
Cool. Any other comments, questions? I do as kind of a personal comment. I thank you and everybody involved in getting that pediatric thing out there. That's how we handle the situation. Since I've spent my whole professional career treating kids and stuff, that's a huge thing to do. And I'm glad we're starting to recognize, they're not small adults and they act different. So thank you very much. I appreciate that.
You're welcome.
Okay, Mr. Health Officer.
Thank you, Mr. Chair. Just wanted to highlight a couple of things to the board. The public health accreditation, our site visit, we now have the dates for, is going to be on June 25th and 26th. And my understanding is that accreditation team likes to meet with some of the board members probably on the second morning of their visit. So I'll be coordinating with Chair Novak on arrangements for that. I think we want to provide them with some board members to speak with, but avoid a quorum for that meeting. So we'll work on that, but we do have our dates now on the calendar, so that's a great thing moving forward. And also on the land development and plan review, just wanted to provide an update from a meeting that Ms. Albee and Mr. Westham and I attended, which Mr. Westham had organized with the Builders Association of Northern Nevada. That was last Thursday. And we set this up to meet with them and talk about how things were going with the changes that have been made with the interlocal agreement with Tumwa for their review of water projects. We established the kind of the transition date from projects that were already in the pipeline that had come to the health district. We're continuing to work on. As of November 1st, every new water project, then TUMWA, under the interlocal agreement, is reviewing for approval. And we did hear some feedback from the builders, and we have had some plans come to the health district that did get reviewed that really shouldn't have been here, and we should have been relying on TUMWA for. So we had a meeting with TUMWA and the Division of Environmental Protection to discuss this further and get things straightened out. And did that occur yesterday or the day before, Mr. Weston? Okay, yesterday morning. He's got as much going on as I do. And so we're working to clarify what our procedures are, and I think this is also going to require some follow-up work with each of the jurisdictions to make sure that the plans that we need to see are coming to us appropriately, but the ones that we don't are out of our loop. So it was useful that we had the meeting to be able to get some input from the building community on how things are going with that, and we'll work to further streamline that process. And then I just also wanted to highlight on the Substance Abuse Task Force. I've mentioned this before. It's a task force that the county manager has led the development of, but includes the participation of both of the city managers and other agencies in those jurisdictions, other external agencies in the community. And we have signed on to a community coalition accelerator that's being offered by an organization that works with communities across the country on comprehensive strategic plans around opioid abuse, which is going to be held on April 5th up at the REOC. We'll be one of 10 communities. This is a new thing that they're doing, where they're taking their experience from working with different communities in the country, and they're doing a national simulcast with 10 different groups. So it'll be an interactive, like a webinar, all-day webinar type event. And we'll be working around a number of different topic areas to develop better plans for how agencies can be working better together to address these issues. And we won't solve everything there. We'll make some progress in a few areas, but I think learn from this as to how we can tackle some of the other areas that aren't going to be addressed that day in the future.
Thank you, Mr. Day.
Thank you.
Any questions? Okay, down to board comments, announcements, agenda items. Councilman Delgado. Okay, Mr. Young, nothing? Okay, Mr. Brown?
Yes, I have one item, possibly be placed on the agenda. I don't think it has to be a voting item, but maybe an update. There's been a lot of discussion that's taking place about public burning, and when it comes to what I used to refer to as curbside burning within Washoe County. It's wintertime. A lot of people don't think about what's taking place with our potential for the wildland fire events that are going to take place this fall or this spring and summer, because we got a lot of white stuff and we received a lot of moisture. But I know one thing in the fire service that we encourage people to do is take care of what's theirs and their property, and when it comes to cleaning up their property. And we've had several years ago programs in place that would allow for curbside or residential burning through permitting processes with local jurisdictions. And I know that the county plays a big part in that with our air quality control. But some of those programs have ceased to operate just because we're trying to meet attainment, which I truly believe we need to do, that's for sure. But I do believe there's times when we should be able to go out there and provide our customers with the ability to remove their flashy fuels. So I'm not talking large areas of fuels, but they're flashy fuels that they can remove safely on their own. It's a cost-effective way of making it happen. And as well as our agricultural burns that used to take place that are starting to be more and more in question. I know there's meetings coming up, and I appreciate that taking place, but I also would like to see a report back to us, because with the events that just took place in California and other places in the western United States, there was a lot of encouragement there prior to those fires that took place on people being able to remove their fuels and fuels reduction issues. And they had some of the same standards, if not more stringent, than we have here in Washoe County. But if we don't allow people the ability at a cost-effective manner to get rid of flashy fuels that can carry fire, we're doing a disservice to them. So I hope there's some options that can come up, and some way we can get around this and actually be user-friendly to our customers here in the future. So that's one comment.
Thank you. Commissioner Bursa.
Just glad to be here. Thank you very much.
Thank you very much. Councilman Dyer.
I just want to.
Go right ahead.
I just want to make sure we put one of these to each of you guys, and actually, we're hoping to probably have somebody come and do a presentation on this. But this is a pretty amazing program. It's called the Parent Project.
Oh, good. Tell them what it was.
It's called the Parent Project, and the Parent Project is where, in the city of Sparks, we have police, some trained police working through a program that work with parents who have difficult children. And it really helps the parent learn how to parent more. It does teach the teen how to respond to the parent, but really you're teaching parents how to parent, probably more than anything. And when you guys hear me say a lot of things about family, I think in every strategic meeting we're in, when I saw this and I saw what they're doing, this is one of the kind of programs I think would be beneficial for us to look at of supporting. Again, there's a lot of moving parts to what we do, but when we're talking about prevention, I strongly believe that the best health care is going to be found when parents take care of their kids more than we're trying to do everything. So this is a great program, and in the future, it's something that I don't know if Reno's heard of it or county and stuff, but this is something that one of our officers that's retiring is going to start doing this full time, or at least a big part of his time, and not really be working with Sparks necessarily, but it's just a great program, something worth your time. Thanks.
I do want to follow up on that. I have talked to Officer Gollop about this, and he's willing to come and do a presentation anytime. This is a national project, and the whole idea is to keep the families together. These are targeted at very difficult kids that are not the run-of-the-mill kids. These are the ones that are problem kids, and parents that don't know how to deal with them or can't deal with them, and he is very willing down the future. Probably won't be until April when he has a little more free time, but he is taking on 2 different organizations that do just exactly this. So it's a phenomenal, very successful program with Sparks Police.
I was going to say, stat-wise, the one thing we like is stats. Well, the stats from this program are really high of what is working.
Yeah.
God bless you.
Pleasure. And it helps your jail budget, too.
It does.
Yes, thank you very much. Doctor.
I don't have anything. Thank you so much for the opportunity to be here.
Well, welcome to the board. I do have a couple small things. One thing I brought up at the strategic planning session is I want to start some board training. Hopefully I'll have some dates. It'll be the idea of having one morning every other quarter and stuff like that for an hour or 2 to do that. You know, coffee, donuts, a little conversation, and move on. But I want to really start some board training to do that. For anybody that hasn't been on the Health District website, I really recommend that you get on and see what's there. It's an extremely well done website. It's good for you can put complaints on there, find out how to apply, good information all the way around, and that's washoecounty.us/health, and it'll take you right there. So if you hadn't, take that online. And I don't have anything else. Since there's no public, do we have no more comments? Good, very good. Can I hear a motion for adjournment?
Motion to adjourn.
Good. Second. Good. Thank you very much for coming. See you next month, and keep in touch.